Hospitals, ambulances, and maternity care are all falling further out of reach as healthcare availability becomes more difficult for millions of Americans. I'm Tisha Pell.
And I'm Lee Zurich. Now, a recent study shows pharmacy access is the latest healthcare hurdle.
Ohio State researchers found Americans in nearly half of all counties live in what's called a pharmacy desert, meaning drugstores are non-existent within a 10-mile radius.
That's thousands of communities, all without local access to essential medications and, in some cases, basic healthcare services. Experts say the trend has been getting worse in recent years, with widespread closures hitting more than just family-owned pharmacies.
Large chains have been closing retail stores in droves, too. Reporter Kristen Crowley takes us to one town where residents say it could only be a matter of time before they fall into the same fate of so many communities before them.
I've lived here most of my life.
For Leota Coates and Teresa Gorman, there's no place like Howard, Kansas.
You like living here.
Yes, I do.
This is home.
This is my home.
But these neighbors, both in their 70s, worry they might not be able to call it that forever.
What would happen if you couldn't get the medications you needed?
I wouldn't be here. No, she wouldn't.
Because they fear it's only a matter of time until the town can no longer support their health needs.
If Batson's didn't exist, how would you get your medications?
I would have to drive at least 100 miles round trip.
You see, Batson's drugstore is not just the only pharmacy in Howard, but in the entire county. It's a half-mile walk from Leota and Teresa's homes, but they worry it could soon be forced to shutter.
How do you feel about that?
Panicked, very panicked, because of being a senior citizen and having that availability.
And they're not the only ones panicking.
I buy as cheap as I can. I don't know what else to change.
Batson's owner, Julie Perkins, says in 2024, there were many months she couldn't afford to pay herself.
I never dreamt that I'd be cutting my salary in half just to get by. There's only so long a person can live like that.
Are you concerned that Howard could one day be a pharmacy desert?
I will do everything I can to make it not be. I can't even think what that would do, so I've cried many a nights over it.
Research out of Ohio State University says pharmacy deserts are a growing problem nationwide.
Almost 1 in 2 counties have at least one pharmacy desert in that county.
Those deserts can lead to healthcare issues in communities, and it's not just tied to prescriptions.
If you look at geographic areas that have a low primary care provider density, those areas are at higher risk of having a pharmacy desert. That obviously is concerning because sometimes your pharmacy and your pharmacist acts as a primary care location site.
In other words, they offer critical services like vaccinations and screenings.
This is becoming a public health crisis for millions of patients who don't have access to a pharmacy.
Douglas Hoy is the CEO of the National Community Pharmacists Association, which represents thousands of independent pharmacies. He says there are a number of reasons for the increase in pharmacy deserts, like staffing shortages, even theft. But the biggest factor,
the low payment from PBM insurance companies to pharmacies.
Pharmacy benefit managers were created decades ago to process prescription claims, but their role has evolved over time.
They now determine how much the pharmacy gets paid, how much the patient pays, and in many aspects, they are the judge, the jury, and the executioner for the pharmacy.
Julie says she can't help but feel like her pharmacy is getting a death sentence.
It's difficult with the PBMs. 80% of my prescriptions are under what it costs me to dispense.
And she's not alone.
High dollar drugs, I was filling them for $30 under my cost.
$30 under.
Under. And I'm not talking about any more discounts. I'm talking rock bottom.
So you're losing money.
Yes.
Lynn Schaefer spent the last few decades as a pharmacy owner in Kansas. He had to close his last store in late 2023.
We had savings, we had IRAs, we had some investments, and we threw that all into trying to keep our store open.
A recent Federal Trade Commission report called PBMs powerful middlemen inflating drug costs and squeezing Main Street pharmacies. Among the findings, independent pharmacies struggle to navigate contractual terms imposed by PBMs that they find confusing, unfair, arbitrary, and harmful to their businesses. The national group representing America's PBMs declined to speak on camera, but said in a statement the FTC report falls far short of being a definitive, fact-based assessment of PBMs or the prescription drug market. Federal legislation has been introduced pushing for PBM reform.
We need patients to go back to their employers and go back to their representatives and senators and say, I've had enough. I need my pharmacy, and I need my pharmacy to be in my community. So get these PBM insurance companies in order and have them stop putting pharmacies out of business.
But it's not just the independents. Some retail chain pharmacies say they are feeling the squeeze too. Walgreens, for example, has closed hundreds of stores in recent years. Representatives for the drugstore chain refused to speak on camera, but said in a statement, increased regulatory and reimbursement pressures are weighing on our ability to cover the cost associated with keeping our pharmacies open. CVS and Rite Aid have also announced widespread closures and layoffs.
I just can't fail. This is my baby.
Back in Howard, the community is doing everything it can to keep Batsons alive. For themselves.
We're older, period.
And we wonder about whether or not the powers that be really care about the older people.
You're invisible.
And so many others in need.
Look at your mother, your father, your grandmother, your grandfather, and know that they need help.
But some experts project things could get worse before they get better. University of Missouri Kansas City School of Pharmacy Dean explains.
Enrollment and interest in pharmacy school has gone off a cliff. Even if you fix the pharmacy closure problem and fix reimbursement, we're not going to have enough pharmacists to be out there providing that care.
He says UMKC's pharmacy school is at less than 70% capacity. Nationwide, recent data shows pharmacy school applications have declined by more than 60% in the last decade. In Kansas City, Missouri, I'm Kristen Crowley.
While it's not the same as a brick-and-mortar pharmacy, experts say possible solutions include mobile pharmacies, as well as telehealth and remote pharmacy services.
Some local and state governments also offer financial incentives for pharmacists opening locations in pharmacy deserts. To read the full statements provided by CVS, Rite Aid, Walgreens, as well as the Pharmaceutical Care Management Association, head to investigatetv.com and search Pharmacy Deserts.